Now, moving on to our first section, and we'll briefly going through the classification of cerebral palsy. Before we move on to classification, what is cerebral palsy? By definition, it is a heterogeneous group of disorders of movement and posture attributed to non-progressive disturbances in fetal and infant brain, which causes limitation activity. So actually, it's a motor disturbances. Which part of the brain is affected? That is the motor neuron. Those which is actually the pyramidal tract, which is coming right from the cortices all the way back into the spine. That is the cortical spinal tract. Once this is affected, this results in kind of an upper motor neuron lesion, which results in multiple gait disturbances. It's the most important cause of motor disability, or the child is actually either not able to sit properly or walk properly, or there is history of delayed milestones. This is the most common causes of the maternal infections such as the torch infections, which includes toxoplasmosis, rubella viruses, and others. Then there may be due to a brain's anoxia or ischemic insult. Secondly, if the child may be born properly, or there may be associated early in the perinatal period, there may be acute severe attack of meningitis, which may result in this kind of a disability. Usually, these children have swallowing and speech issues as well, may be associated with along with the motor disturbances as well. There may be a history of epilepsy as well, and epileptic fits are quite common in these children. There may be, as these children are actually having multiple issues with the motor disability, and there may be always behavioral disturbances as well, because these children are special and they need special care, and sometimes they need special kind of instrumentation as well, so that they can get at least sit and do their they can at least care for their hygiene and other issues as well. But sometimes with quadriplegia, that is not even possible, so they're very much dependent upon the mother. Coming to the classification could be, it's unilateral if only the one side is involved, which includes hemiplegia. That is, if you see this diagram, this is the whole one side is affected, that is upper arm and the lower leg as well. It could be monoplegia, whether it's usually a single arm or single leg is involved. Most commonly in case of monoplegia, it is always the arm which is affected rather than the leg. Or it could be bilateral, affecting both sides of the body. This causes diplegia, and then there is called as total body involvement or quadriplegia. Usually diplegia means involvement of the one half of the usually it is either the lower limbs or the upper limbs. And then it's a total body, also called as quadriplegia, that is both the upper limbs and the lower limbs are involved. So now coming on to what is unilateral cerebral palsy. As I just told you, it involves the one side of the body. Hemiplegia, as it can be seen in this diagram over here, whole of the one side is involved. Usually it's an upper motor neuron lesion. It's the most commonest form as well. It is spastic palsy of one side of the body. Why it is spastic? Because it has corticospinal tract is affected. That is a classical upper motor neuron lesion. Usually upper limb is more severely affected than the lower limb. Children can walk and respond well to the treatment. Usually, as it's a common form, although it's a less severe form as well, and they usually respond very well to the different types of treatments such as physiotherapy, splintage, and maybe sometimes surgical options are always utilized as well. The next form of the or subform of unilateral cerebral palsy is monoplegia. That is only either the upper limb or one of the upper limb and one of the lower limb is affected, but usually the upper limb is affected more. It mainly affects the upper limb. True monoplegia is usually unusual because there is always some degree of paresis of the other arm as well. This is usually can be confused with neonatal brachial plexopathy or acute brachial neuritis as well, because usually if a child is born with flail limb of only one side, and the first common thing usually we start thinking about, for example, Ehlers palsy, Compey's palsy, brachial neuritis, other brachial plexopathy. These are all the differentials which do come into mind when we are dealing with monoplegic cerebral palsy. But as it's neuromuscular and it involves nerve, it involves muscle, so cerebral palsy should be kept in the differentials when we are dealing with a child who is born with a single flail limb. Now coming to the other part of the classification, that is the bilateral cerebral palsy. Bilateral means involving both sides. It could be diaplegia, as you can appreciate over here, one half is involved, and usually that most commonly it affects the lower limb. It could be triplegia as well. That is only one arm is spared, but both the lower limbs and one of the upper limbs is involved. Or the total body involvement, also called as quadriplegia, or all the four limbs are involved. What is diaplegia? Both sides of the body are involved. As I just told you, lower limbs are more severely affected as compared to the upper limbs. Side to side asymmetrical involvement is sometimes present, but not always there. Sometimes very symmetrical. That is, what it means is that although both the lower limbs are involved, but one limb is more severely affected, there is increased amount of contractures, there is increased disability, and there might be less intensity of cerebral palsy manifestation on the other side. Usually it's can lead to prematurity, and if these it's more common in the children which are born prematurely, and there is reasonable mobility and intelligence. As upper limb and upper torso are not affected, usually their speech and all those other areas are not affected much. Therefore, they can talk very well. They can carry out their upper limb functions very properly. Although mobility is severely compromised, but that can be corrected with different modalities later on, which will be described in this lecture. Now, coming to the total body involvement, it's actually, if all the four limbs are involved, it's more a severe form, and it's, although it's very rare, but yes, it is always the present times, and it needs more care. These children, as they all four are paralyzed, so they cannot really take care of themselves regarding food and regarding hygiene, regarding even they cannot sit up sometimes properly because of severe scoliosis and involvement of spinal muscle as well. So they need special equipment, special wheelchairs, electronic wheelchairs, in which they can at least support their neck, and sometimes they need extra head straps as well in these, so that even the neck cannot be supported very well. Therefore, these children who have four total body involvement, they need extra special care, especially from the parents. As in this section, we have gone through the classification of cerebral palsy. As you know, it's a non-progressive neurological disorder secondary to hypoxic or anoxic insult at the time of the birth. Usually presents with monoplegia or hemiplegia, the half side of the body. But if it's bilateral, it can be presents with diaplegia or even quadriplegia. The more the severe involvement is, the more the care this child needs. That's all from this section. Thank you very much. Keep watching sqadia.com.